Utah, we had Utah Valley University, the Salt Lake Community College, Utah State. They came to talk. They were there and had tables about services that they provide on campus for youth and young adults with special needs. Talked a little bit about their health services that they provide there on campus. We had Utah Transit Authority, Utah Parent Center, um, Voc Rehab, just a whole bunch of different organizations there. Families were able to wander through and meet with those folks. We had a lot of information from SSI and the ability for people to sign up for interview times for SSI via a sign-up sheet that Julie Southwick was able to get set up with our contact for SSI. So that was really, really a terrific opportunity for some of our families to get that set up as well. We provided some food and cake and snacks and kind of made it a nice evening for people. It's always good when you give people some chow. I think that always makes it a little bit nicer event and gets people a little more excited to be there. And interestingly, that was voting day. So we combined the best of both worlds with voting day and that event. We did that for about an hour from 6 to 7. And then at 7 o'clock, we asked everybody to come into the other room so we could do video presentations. As probably a lot of you are aware, we have been recruiting and requesting youth and young adults to submit very short videos. These are anywhere from 30 to 60 seconds that detail an event in their journey to transition to adult healthcare. And these could have been anything from, we gave prompts like filling your own prescription for the first time or talking to your provider without your parents being there. Or what was it like when you went maybe away to school and had to set up care with the school, maybe the university or college healthcare system. So we gave a whole bunch of prompts there for youth to submit. The year before, we had one submission. This year, we had 6. So we felt like we really increased just exponentially the number of entries that came in. And I have to tell you, these youth were very creative with how they submitted entries for our video contest. We had a young woman who actually sang about who she is and what her abilities are, and so set that to music. We had a young man who did maybe under 30 seconds, a very humorous kind of tongue-in-cheek little skit. We had a young lady who talked about talking with her own healthcare provider and how that made her a little bit nervous. And then we had a young lady who had a shirt and a display and just all sorts of stuff that she was able to talk about, how she is preparing herself to be able to talk about and be as independent as she can be as she moves into that adult world of transition. Everybody, all our participants got a swag bag full of fun little prizes, a certificate signed by Dr. Giardino from the University of Utah. And then our grand prize winner received a $250 Visa gift card. And we also announced that night, and then again the next day at the summit, that our video contest is officially begun for this next year. So we're encouraging everybody who has contact with youth, young adults in your practices, in your organizations, in your agencies, to please encourage youth who are at transition age to submit an entry for our video contest. They can start coming in as soon as now. We won't judge them though until probably August, September-ish of 2025. And we'll do a similar gala presentation right prior to probably the night before our 2025 Transition Summit. And we'll award prizes once again. Now, I've said this before and I'll say it again. This is a twofold purpose for doing these videos. We want youth to have the opportunity to share their voice, share their successes, and talk about these wins of independence as they move into transition. But we also want to make those videos available to anyone who may be working with youth so they can share those videos, basically a peer-to-peer video to encourage youth to say, hey, if these youth could do it, you can do it too. We feel like there's a lot of power coming into this from youth to youth sharing experience versus a provider, an adult, a parent, maybe coming across as being a little bit preachy or, trying to encourage kids to do some of these things on their own, whereas other youth have a lot more power to discuss that. So we're really pushing that out, and we'll make sure that you have the information sheet and the registration sheets. We'll ask Athena to send those out to all of you so that you can encourage any youth who might be having successes in your offices or your practices, your agencies, to submit an application for 2025 and submit a video. The next day at the Transition Summit through Intermountain Health, we had a hybrid event. It was live and also online. And we had just a really wide variety of topics. We were fortunate enough to have a panel of youth serving provider, adult serving provider, and a young man who had was spina bifida, who talked about his transition process, working through the process with the pediatrics and how that transition happened to that adult provider, and all of the intricacies that happened there, the communication and the way it was so smooth because of all of that communication. And so that was very helpful for all of us to understand some of the ins and outs that need to happen to make that be a smooth transition. And he was there with his wife and mom. So we got to get that from all perspectives to hear how that transition was so successful and how well that worked. We also got to hear sibling perspective of what it's like to be the sibling of someone with special healthcare needs, but also to be that supporting and encouraging role to help her brother go through all of the facets of transition and be supportive and live with a family member, live with a sibling who has special healthcare needs and move through those transition parts and pieces that the whole family has to help support that youth go through. We were also very fortunate this year. Not only did we announce the awards that we gave for our video contest, but several of the practices were able to nominate special youth in their practice who were really knocking it out of the park with their transition efforts and were such great examples and very inspirational to those practices. And so several practices were able to give awards to those youth in their practices. And I think being able to recognize publicly some of these youth was very powerful, impactful, and even just a little bit emotional. I think each year these transition summits get better. We learn from experience as we are doing this in the state with more regularity. we're learning from each other. We're learning from our patients. We're learning from our practices. We're learning from working with each other within our organizations, how to do this better, how to do this in ways that are more impactful for our youth so they can be better prepared. And we have more providers who are coming on board, establishing policies for transition within their own practices, and really making this something that's across the state, not just in small areas. So if you didn't attend this year, we really encourage you to think about it for next year. It's usually right around the same time. Last year, it was after Thanksgiving, but usually it's early November. And we don't have our dates quite yet, but we will let folks know with kind of a hold the date, mark the date card as soon as we have that plan through our committee. But you should probably anticipate probably end of October, first part of November for 2025. So if you did not attend, please plan to attend this year. I think there's important information to take back for any of you who are working with youth to have some impact on both your office and the youth, getting them prepared to move into the adult healthcare world. And I'll pause for just a minute and see if there are any questions, anything anyone wants to bring up. I don't know if anyone attended and had, wanted to mention anything that they felt was impactful, but I'll pause for just a moment. And if not, just know that I will send those slides over to Athena. They do have the videos that we watch, so you can, there will be a link. I apologize, they are not closed captioned. We're working on that. The sound is a little rocky on a couple of the videos. We'll also include the flyer that has all of the links for permission forms and other pieces of information for the 2025 video contest. And we would ask that you distribute those to any people you think would have contact with youth, or if you do have direct contact with youth, to please encourage them to submit anything about their transition experience.
And Eric, it looks like Amy had a question.
Just a comment. Lexi Dopp, who did the sibling presentation, actually re-gave that presentation last week, and it was recorded through the Utah Parent Center. And so I can share that link with Athena if others think that might be a useful talk to watch.
And she's an outstanding speaker, very engaging. So yes. It's worth the time to listen to that if you have time. And I do encourage you to, if you have a minute, to just watch these videos. It won't take you more than probably 10 minutes to watch all of them, but these youth are really fun, really amazing, and incredibly talented and brave kids to share this information. And I'll leave it with that, and I'll leave it there.
Great. Okay, thank you, Eric. We are going to open it up now for our brainstorming session of our meeting. So if anybody else has any announcements, cases they want to bring to the group, new resources to share, updates, ideas, this is your time to go ahead and be vocal. See. Oh, Jade had a comment in the chat that she was thankful that you summarized the meeting, Eric. And she'll be able to attend next year. Anyone else have any cases they want to bring up? Announcements, resources?
May I ask a general question of the group here today? What is the consensus for any of you who are working to get kids scheduled for autism evaluations or ABA therapy or anything like that? Are you finding that you're having long wait times to get that done? Or are you finding that you're able to get kids in a little bit quicker than you had in the past?
Oops. Hey Eric, it's Heather. I feel like it's gotten better around the Wasatch Front personally. Um, Less wait times. I've been able to get in some kids within a month for testing. So it just seems like, at least along the Wasatch Front, it's gotten a lot better recently. That's my opinion.
Do we have anybody else that would second that, or how about anybody else that's in our rural areas that, um,
And so this is Kaylee. I know that I'm really new, but from when when Erica was teaching me, she said that we were quite a few months out when it came to the autism testing. But I did meet with the primary children's outreach program last week, and they were saying that they had got a rural outreach group kind of put together, and they're thinking that now with this new group that will be specific for rural health. That the wait times now will be like a month or two, which is way better than what we were looking at before. So that's what they told me last week was what was about to start happening for the rurals.
Haley, and that primary children's outreach group, did they tell you where they're going to be doing outreach by any chance?
They said for the most part, they're going to be doing a lot of telehealth, and they feel like they would be able to diagnose just as well doing telehealth as they would in person.
Perfect. Okay, great. One good thing about primary children's is they, with them being, a children's hospital, they accept all sorts of insurances. So that's definitely, breaks down a lot of barriers with getting services provided. So just kind of curious about that. My sense was that things were a little bit better, but I just wanted to kind of get a general consensus there. Okay, thank you.
And Haley, sorry, is that information you could share about that new clinic contact that you have, maybe in the chat?
Yeah, I will look at his information. We actually got connected because there's a grad student that's going through the U that's wants to specialize in pediatrics, a DNP student, and her father is actually the doctor over the health department. So she was trying to tie us together. So she got us introduced, but I will share that with you guys because I thought it was a great resource for us to have. So I would love to share it with you guys.
Thank you. That's the exact kind of resource sharing and things we want to happen in this time during the meeting. So, great question, Eric, to prompt that response. Anybody else have anything they want to share, questions they want to bring to the group?
All right, I got one more then. I just wanted to ask about holiday needs for families. I know we're but a week away, 7 calendar days until Christmas. But just wondering what the general sense has been from the community as far as needs. Stuff for Santa, the Toys for Tots, any of those sorts of things. If you've been seeing increased need this year, if you've been able to make referrals, if you've had families reaching out that have needs like that, if you're lacking resources or not really sure where to send families for any sort of holiday help.
So I've had issues with a lot of families this year that aren't being able to access services. I've had families that have signed up for Toys for Tots, but they went for pickup and there was nothing for teenage boys. There was hardly anything for boys up in northern Utah. She was only able to get something for her little girl. So I am like reaching out to DSPD. I'm reaching out to just everyone I can think of to try to see if we can find anything else for some of these families. But so far, everything's full, at this point, which, I mean, everything's full by the end of October around here. So, I don't know. I'm just grasping at straws now if anyone has any recommendations.
Yeah, and this might have been a topic to discuss maybe a month or two ago, right? Versus now. I know a lot of times people really feel the crunch as it gets closer, and I know a lot of those things fill up early. So I just wasn't sure what what the saturation was on anything like that. Okay. I did know that as far as food goes, I know that I believe Roland Hall here in Salt Lake on the 23rd of December is giving out like Christmas meals, like turkeys and food and things like that. So 10th East and around 9th South area here in Salt Lake City. Not super helpful if you live outside of Salt Lake City, but they were going to be offering meals until they're gone. So it was kind of like a get there, first come, first served. And we did have information on that came through, and I can send that along as well over to Athena for distribution as well. Or at least, a Christmas meal or something like that.
Yeah, why don't you plan to send it over, Eric, and I'll get that sent out with the notes.
I'll send that over right now to you, Athena. Thank you.
Okay. Great. That's a good, yeah, I think you're right. Maybe this is one we can put on the agenda to always like hit on in October. So that people can start thinking about it early enough to get signed up for those programs. Let's see. Abby put in the comments back to ABA. She had heard that Primary Children's Rehab is starting an ABA program at the Riverton Clinic. So there's another resource for ABA. Okay, we're going to jump into our learning session for today, but if you have any comments on things that have been talked about this far in the meeting, go ahead and stick them in the chat. We'll try to address them like via the chat while the presenters are going, or in the meeting notes after the meeting. But today we are lucky enough to have some folks from Medicaid with us to talk about eligibility and services. And first we're going to hear from Wendy Jones and Marilyn Fischer, who both are with the Office of Eligibility Policies, kind of an intro to some of the stuff that Josip will talk about. So as a little bit of an intro for both of them, Wendy's been with the state for 13 years and one of the coordinators on the policy team. When she started on the team, she was over the Children's Health Insurance Program, or CHIP, and the Utah Premium Partnership for Health Insurance, and the employee-sponsored insurance part of the adult expansion. So after about a year, she switched over to Presumptive Eligibility Program and has been with them until she was able to become one of the coordinators. And Marilyn has worked with Medicaid for over 30 years as an eligibility specialist in outreach, health program representative, quality control, and policy, and is currently over the aged, blind, and disabled program. So again, I think we're going to have a wealth of knowledge here from both Wendy and Marilyn. And I'll go ahead and introduce Josip as well right now, because their program or their presentations are going to kind of meld into one another. So Josip graduated from the University of Calgary with a bachelor's degree in economics, and since 2008 has worked for the state of Utah with the nursing home and community-based waiver programs. First with the Department of Workforce Services conducting financial eligibility, and then moved to the health department in 2012. He is currently the director of the Office of Long-Term Services and Supports within the Division of Integrated Healthcare at the Utah Department of Health and Human Services. So I'm going to go ahead and turn the time over to them for our presentation today.
Thank you, Athena, and thank you for having us come. We're excited to give just a little general preview of our Medicaid programs. Let me share my screen. Can everybody see that? Oh, I didn't click share, sorry. Okay, can everyone see the screen that I'm sharing? Okay, awesome. So what we're going to do today is just give a general, sort of high level overview of our Medicaid programs, and then Josip is going to go more into the waiver programs. So this is really just designed to just give you that general knowledge. And then of course, Marilyn and I are available if you have questions. Feel free to reach out to us. Athena does have our email address, and then we did provide these slides, so I think she might be able to send these out to you if you want that as well. Medicaid benefits do vary in scope and age they do vary in scope depending on age, pregnancy status, disability, etc. I am going to go over our Magi-based programs, and we'll talk about Magi on the next slide, and then Marilyn will go over our non-Magi programs. So please don't hesitate to stop me if you have a question. I'm happy to answer questions, or if you want to hold the questions till the end, that's fine as well. But as I said, I will go over the Magi programs. Magi stands for Modified Adjusted Gross Income. So Magi uses IRS tax rules to determine the adjusted gross income and the household size. So for Magi tax filers who are filing jointly, so they, their spouse, their tax dependent children would all have the same household size. When we're looking at Magi programs, if we are talking about non-Magi or non-tax filers, then their household size is determined based on who they are living with, and the non-Magi programs also go off of who they are living with in household relationships. Questions on Magi before I move forward? And now that I'm sharing my screen, I can't see if there's like hands raised or anything. So Athena, if you want to help me with that, if anybody does.
I'll try to moderate for you.
Okay, thank you. Okay, so the first program that we're going to talk about is our Parent Caretaker Relative, or PCR program. This is a program for adults, so they do have to have a dependent child living in the home. One of the nice things about this program is that they could potentially be eligible for our transitional program. So if someone is on PCR, and notice that the income limit for this one is really low, it's about 34% of the federal poverty level. So if we have someone that is on the PCR program and they have earned income that puts them over that 34% of the federal poverty level, if they were able to get PCR for at least 3 out of the last 6 months, then they could potentially be eligible for our transitional program. The transitional program then would allow them up to an additional 12 months of that PCR coverage, even though they're over the income limit for PCR, which is a nice benefit. Also for the PCR program, if we have someone who has spousal support that is counting towards the medical program, and they have an increase in the spousal support that puts them over that PCR income limit, then they could potentially qualify for the 4-month extended transitional for PCR. So we do have those 2 additional options for PCR, which is kind of nice. The next program that we're going to talk about is our Pregnant Woman program. This goes up to 139% of the federal poverty level, and we do have our income chart included at the end of the slides, and Marilyn will go over that. One of the nice things about the Pregnant Woman program is that once you're qualified for this program, you will stay on this program for the duration of your pregnancy, and you will also get the postpartum period, which just starting in January of this year increased from the 60-day postpartum period to now you get 12 months of postpartum coverage, which I think is a really great benefit. So you're locked into that program. You will get the full coverage of the full pregnancy and then the 12 months of postpartum. Another really great benefit of the Pregnant Woman program is that the child or children that are born to a woman that's on Medicaid, those children actually will get our Child 0 to 1 program, and they also will be locked in for 12 months of coverage. So it's really beneficial for people if they're pregnant to try and qualify for Medicaid, because they'll get the full pregnancy covered, the 12 months postpartum, and then the child will get the 12 months of coverage. That leads me to our children's child program. So we do have the 3 child program categories. So we have the 0 to 1 that I talked about, and then we also have child medical 0 to 5 and child medical 6 to 18. So notice that we have the 2 different income limits for that. So for the 0 to 5, the income limit is 139% of the federal poverty level, which is the same as the Pregnant Woman program. If we're looking at the 6 to 18, that income limit does go down to 133 for those children that are 6 to 18. Sorry, go ahead.
I was just wondering if you had a slide specific on the child programs. So, but
we do not. No.
Okay, thanks.
Sorry. Our next category of programs are our adult expansion. That one does go up to 133% of the federal poverty level, so same income limit as the child 6 to 18 program. This is for our adults, and it would be for people who are between the ages of 19 and 64. One of the nice things about the adult expansion program is that we are able to send a reimbursement check to members who qualify for the employer-sponsored reimbursement, which we'll talk a little bit more about on the next slide. And then we also offer our Targeted Adult Medicaid, or TAM program, for adults as well, and we'll talk a little bit more about that. Notice that the income limit for the TAM program is really low. And so when we're looking at TAM for our members, we do try and get that program approved as quickly as possible, because if anyone is employed, they'll likely be over that 5% of the income limit. So questions on that before I move forward? Okay. So for adult expansion, as I mentioned, we do have an employer-sponsored insurance part qualification for the adult expansion program. So anyone that is eligible for adult expansion, we need to know whether they have a qualified health plan offered through their employer. If they do have a qualified health plan, then they are required to sign up for that employer-sponsored insurance. And then the state will reimburse their portion for that employer-sponsored insurance. If they have a spouse, so let's say that we have a husband and a wife who are both eligible for adult expansion, and we have only one of the spouses that is working and they have a qualified health plan and they choose to cover the family, because both of those adults have adult expansion, the state will then be able to reimburse for the employee plus spouse portion of that employer-sponsored insurance, which is really nice. If they're eligible for that, they do get a monthly reimbursement check. Like I said, that would either cover their cost, or if they are signed up for either the employee plus spouse or the family plan, it would cover the employee plus spouse cost for that. If someone does have access to a qualified health plan and they do not sign up for that employer-sponsored insurance, then they are subject to a 12-month disenrollment period for the adult expansion, which means that not only will they not be getting that reimbursement check, but they also would not be eligible for Medicaid because they are disenrolled. For the TAM program, we do have some subcategories for people to try and qualify for the TAM program. We have chronically homeless, justice involved, or individuals who are needing treatment. So when we're looking at the TAM program, they do have to have a referral, and depending on where the referral is from, that tells us what subgroup they need to go into. So if they're eligible for more than one subgroup, then we're going to initially put them, if they qualify for justice involved and chronically homeless, we're going to put them in the chronically homeless group. There is a hierarchy when we're looking at TAM, so we're trying to get them approved for the chronically homeless above anything, and then second would be the justice involved, and then third would be individuals needing treatment. In order to be eligible for TAM, they do have to be diagnosed with a substance use disorder, a serious mental illness, or things of that nature. And that would be true for any of the subcategories. Referrals do have to go through approved agencies. And one of the nice things about TAM is once we get them approved for that program, they also have 12 months of continuous eligibility. So they're locked into that program. And so, like I said in the beginning, we try and get this approved as quickly as possible because that income limit is only 5%. So if we have someone that's eligible for TAM, we get them approved on TAM and then they get a job and they're over income, that's okay because they're locked into that program for 12 months. Any questions on those two programs? Okay. And then the last group that I'm going to be talking about are the Children's Health Insurance Program, or CHIP, and our Utah Premium Partnership, or the UP program. So CHIP we have 3 different plans for CHIP. Notice that we have different income limits for CHIP. So if someone is eligible for Plan B, that means they could be up to 150% of the federal poverty level. And if it's Plan C, then it's up to 200% of the federal poverty level. We do also offer state CHIP, which goes up to 200% of the federal poverty level. That was a new program that we started in January of this year. CHIP, actually, the state CHIP is currently closed. The open enrollment for state CHIP did close at the end of October. And once we have funding for us to reopen that program, we will reopen that, and we will, of course, notify the public. We'll do the same sort of notification that we did when we initially started the state CHIP. So I believe we would send out information to providers. I know that it was, there were notices in like the Department of Workforce Services offices. So we definitely let the public know when we are having an open enrollment. CHIP was for our non-citizen children, which was nice. And we, like I said, did have an open enrollment. So it was open from January 1st until October 31st. And then the last program that I'm going to be talking about is UP. So UP works similar to the employer-sponsored insurance part of adult expansion, only UP can potentially pay for the whole family plan. So with UP, there's a max that they can do. We won't ever pay more than what the premium is being charged by the employer. But with UP, the parents can get up to 280 and the children can get up to, let me get back on that because I might be telling you the wrong amounts for that. Oh, sorry. But with that, because we won't pay more than the plan, we'll pay the maximum amount for each of the adults, and then anything that's left over will pay up to the maximum amount for children. So for most people that are on the UP program, 100% of what they are charged for their insurance is covered, which is nice. So sorry, give me just a second. I can put that in the chat. I'm not finding it really quickly. But it's nice because that, again, is a reimbursement that is sent to the member monthly. If the employer offers dental insurance, each child can get an additional $20 to cover the dental coverage. If the employer does not offer dental, then the children are covered with the CHIP dental for UP. So questions on any of that before we send it to my colleague Marilyn? Okay, great.
Okay, even though it says that I'm Wendy Jones, I am not. I'm Marilyn Fischer. Medically needy programs. These are the programs for individuals who are over the income limits for certain programs, and they can spend down to that income limit in order to be eligible. There is also an asset test for these programs. And these individuals can use cash or medical bills to meet the spend down. The spend down does not have to be met every month. It only needs to be met in the month they need coverage for. For pregnant women, they only need to meet the spend down once during their pregnancy, and then they get all the other benefits. They're covered from the first of that month through the end of their pregnancy plus the 12 months. So the programs that that have a medically needy option are the family programs. Adults with children are, after we've looked at the Magi PCR program, they can look at having a family medically needy. Children can also have the family medically needy, as well as, like I just went over, the pregnant women. Age blind and disabled individuals who are over that 100% income limit, they also can have a spend down. So our aged blind disabled individuals must have an income under 100% of the federal poverty limit. Aged is for those that are 65 or older, or they meet the requirement for blindness and disability. Disability is either determined by our medical review board or by Social Security. And there is an asset test that is applied for this. We also have a program called the Medicaid Work Incentive Program. That program is for disabled individuals who are also working. So this allows them to keep more of their earned income. So there is some income disregards, which is $65. And then you take half of what's left over, and that is their only countable income from their earnings. Then they pay a percentage based on how far they are above the income limit. It can be up to 15%. This would be considerably less than if they were to go with the spend down route. The one thing with the Medicaid Work Incentive Program is the premium must be paid by cash, like your cash, your debit card, credit card. Individuals who have the Medicare Part A and Part B can qualify for a Medicare cost-sharing program. If they're under 100%, they're a qualified Medicare beneficiary. What this does is it reduces their premiums, deductibles, and co-payments. Specified low-income Medicare beneficiary, it pays for only the Part B Medicare premium, which this coming year is $185. And qualifying individuals, the QI also just pays for the Medicare Part B premium. Okay, I'm going to have this one go back to Wendy because she knows about this program.
Presumptive eligibility, that program provides temporary Medicaid coverage. This is offered through Baby Your Baby or through the hospital presumptive eligibility program. For Baby Your Baby, someone actually can go online and apply themselves, or they can go to a clinic or a hospital and apply for Baby Your Baby. The hospital presumptive eligibility, those applications are submitted through hospitals. We do have to have contracts with all of these providers. The decisions for presumptive eligibility is based solely on their self-attestation answers to the questions to the Medicaid application. Potentially for the presumptive eligibility, they could potentially get coverage for up to almost 2 months. Presumptive eligibility works a little bit different than normal Medicaid. The coverage starts the date that the provider makes that approval, and then it goes potentially to the end of that second month if there hasn't been a decision made by the Department of Workforce Services for ongoing Medicaid. The presumptive eligibility applications do also act as a full Medicaid application. So those applications do go to the Department of Workforce Services for them to be able to determine ongoing eligibility. If they are eligible for ongoing Medicaid, the presumptive eligibility program closes and then it seamlessly transfers into the regular Medicaid program that they were eligible for.
Okay, other medical assistance programs available are former foster care. These are individuals ages 18 to 26 who were in state custody in foster care on or after their 18th birthday. They had to have been receiving some type of Medicaid during the foster care period in which they turned 18. There's also foster care independent living. That one is for individuals who were in foster care under state custody on or after their 18th birthday. They did not have to be eligible for Medicaid while they were in state custody. And they can receive this coverage until the age of 21. This includes members who are foster care in any state or tribe. Home and community-based waivers will be covered further, but they provide extra services so they can live at home rather than in an institution. Utah does have 9 home and community-based waivers, and they are listed there. So Josip is going to be going over those more thoroughly. So our 2024 Medicaid income limits, we have an income limit chart, and it shows basically what percentage of the federal poverty limit they're at. Currently for our ABD programs, you can see it's 100%, and the cost sharing can go up to 200%. That QDWI, we don't have a lot of those, but it basically goes up to 135%, and you can see the actual amounts. Now, these income limits, even though it says 2024, our new income limits for 2025 are usually effective in March. Sometimes it's been April, but that's been quite a long time since it was April. But the new income limits are March. What happens with our ABD members, because they get their increase in Social Security. If they were eligible for, if they were under 100% for ABD program and the cost sharing program in December, we disregard their increase in their Social Security for January and February. And then in March, we start counting all of it again and compare it with the 2025 income limits. Now, if they were on a medically needy program already and they were paying a spend down, nothing changes. They're just going to have an increased spend down for January and February. And here's some helpful links for Medicaid where you can apply, description of the programs. There's also for the Medicaid member guide, and this is given to all the Medicaid members, the new members, so they can have it's a basic overview of information for what's covered. We also have our constituent services. When what Tracy does is if there's a problem, they think they've been denied incorrectly, given the wrong program, they of course need to first try to work that out with their eligibility worker. If that doesn't work, they can talk with Tracy. We also have our health program representatives, and they're the ones that help find providers for members, and they also help with the assignment of our affordable care organizations, our ACOs, because in some counties in Utah, you have to be enrolled in one of those. Questions?
Hi, this is Tony. Sorry, let me turn on my camera here really quick. My question is, I have a family that they are struggling with trying to get Medicaid because they don't want to provide their bank statements. Is there any way around that?
We do have a program called the AVS system, and what that does, it's an asset verification system. And what it does is we look at, it's a big pool of all the banks and credit unions and that. And so what they do is if they report they have $100 in a checking account at Zion's Bank, but what pulls up on our AVS system is, oh, they have 3,000. That is questionable, so we can't use it. We have to have the statements. Or if
Okay,
the AVS doesn't pull it up at all.
okay. But if it does pull it up, she's kind of, I don't know, she's just really concerned about like giving her social security number and just all this,
No, that's
security type
understandable.
stuff.
What I would suggest is if she has her statement printed out, block out her account number except like for the last 4 digits.
Mm, okay,
That can be helpful too. If
okay.
there's because the caseworker is going to look over it, and if there's any strange deposits, like, yeah, if they work and get paid every week, okay, we expect those deposits. But
Mhm.
if all of a sudden there's $1,000 deposit, they're going to question that.
Okay,
So,
yeah.
yeah, that's what I would do is just if she would submit it and just all but the last 4 digits of her bank account number and
Hmm.
that. So she
Okay,
can do that.
okay, thank you.
I wanted to ask a question. This isn't really about eligibility, but this is almost more about like renewal or review time. How far in advance are families or recipients sent notice that it's time for case review or renewal? Is that 60 days before case is due for review or
Okay.
does that
Yeah.
depend?
Yeah, well, it depends. Okay. We have what's called now as an ex parte review. That means the member's not even going to see a review if they can complete it. What usually happens in that is if they have self-employment, they're not going to qualify for an ex parte because I think we all know that changes a lot. But if it's something like Social Security, if you're on Social Security, what we do is we run the AVS search and we run our e-verification search. And that includes like their vehicles, wage history, their Social Security, things like that. And if a caseworker can look at it and say, okay, I know their Social Security has increased. We know the 2.5%. We know that they have this 1990 Toyota Corolla. It's still there. There's no other new vehicles. We've done the AVS search. They're still under the asset limit. Great. Then they can do it and they just get sent a notice that, hey, we were able to complete your review and this is when your next review is. If they can't do it, like in the case of self-employment, yes, they will be notified almost 60 days in advance. The review will be sent to them, and yeah, they have like 60 days. If a member needs more time to complete a review, like if they have to turn in some verifications, and it's going to take them a little bit longer, they need to make sure to ask their caseworker for additional time as well. So
And
we have,
oh, sorry, Marilyn.
go ahead.
Just to add on that, they don't have to submit the review paperwork. We do offer the ability for them to complete a review over the phone. So if that's easier for them, they can call and do the review over the phone. They also could do it through MyCase as well, which would be just the electronic version of the review. So they have a few options. We try and make it as easy as possible for members to complete their review.
We, I have a team of care coordinators who oftentimes is, just trying to, I don't want to say babysit, but, just trying to make sure that it's so much easier to keep families on than try to reapply or, do things like that, or have that lapse in coverage because families didn't get in approved verifications or, things that they might need to verify. So I was just trying to look at that time frame and just make sure that families are on top of any sort of notification they would get of if they have to verify anything or do that type of submission of documents or anything like that. So just kind of wondering what that time frame was on that. So thank you very much. I appreciate that information. And it's certainly nice that ex parte is far more high tech than 25 years ago when I started at DWS and we didn't have the ability to do that. So very nice.
We did not. We did not.
Thank you so very much. That was very helpful.
Any other questions?
I haven't seen any come in through the chat, so I think we can move to the second part of the presentation.
All right. Sorry, I moved my unmute on me. Good to be with you this morning, everybody. As Athena mentioned, my name is Josip Ambrenac. I'm with the Office of Long-Term Services and Supports at Medicaid. Spent some time as well with DWS in the past, so a lot of fond memories looking at the slides from Wendy and Marilyn. But I'm here to speak with you about the state's home and community-based services programs. Utah currently has 9 waiver programs, each with its own kind of different target population, demographic, and age ranges. So I'll provide you with kind of an introductory view of each waiver program, kind of who it's intended to cover, and then a little bit on the age ranges for you as well. But to start off, really kind of sharing the basics of the waiver programs. Again, we do have to define a target population with our partners at the Centers for Medicare and Medicaid Services at the federal level. We do have some options as well as it relates to the program structure. While all of Utah's waiver programs are available statewide, we can apply to have them target a specific area of the state if we were to look at that. There's a few concepts in here that I'll also talk about with respect to waiver services versus state plan. The waiver programs end up being the payer of last resort or coverage of last resort, meaning that all other services must be used before we can look at the waiver to access them. So that would include private insurance, Medicare, if they are on a state plan program, and then again, the waiver supports would come in on the back end as well. We do enter into what's called a state implementation plan with CMS for each program, which kind of mirrors or emulates its own little Medicaid program itself, where we have quality assurance measures that we need to demonstrate to CMS. We also have the requirement that these programs are cost neutral. All waiver populations meet a facility-based level of care, so either nursing facility, intermediate care facility for individuals with intellectual disabilities, or hospital level of care. In Utah, none of the 9 waiver programs use the hospital side, but that cost neutrality requirement means that we need to demonstrate to CMS that on aggregate, so considering the entire population, it is less expensive to serve the individuals in the community than it is the facility-based equivalent. So that's something that we need to work with. We do financial reporting with CMS every year that goes into that piece. Something very interesting that kind of builds off of what Marilyn and Wendy said was the waiver programs are also unique where we can target eligibility to the member who is applying for services. So a lot of the time, the entirety of the household is looked at for the purposes of Medicaid eligibility. We are allowed to look at just the single member who is applying. So for our programs that cover children, it allows us to essentially ignore the parent's income and assets, which is very frequently prohibitive if you're thinking of a middle income family or above. Normally that would disqualify them for coverage. But again, if we are just looking at coverage for the child, it allows us just to focus in on them. So and not to go into too much of a tangent, but that was very much the impetus for the medically complex children's program was you did have a lot of very complex kids that had very high medical bills, even considering private insurance, co-pays and other co-insurance requirements, effectively brought that family from that middle income status down to a poverty-like situation. But until that waiver was created, that notion of gross income versus net income could not really be considered. So,
Goodness gracious.
sorry, a little bit of feedback there, but let's see. And one of the primary focuses of the waiver programs is, again, to provide support to individuals to allow them to live as independently as possible in the community in the least restrictive setting that they are able to live in, acknowledging their health and safety needs as well. So I touched on this a minute ago with respect to state plan services. And again, for the majority of the programs, which Wendy and Marilyn covered, the state plan portion is what you qualify for under each of the groups that they provided. There's some nuances between programs like what we call traditional Medicaid and CHIP, or the targeted adult Medicaid, so that there are some coverage pieces to be aware of, but largely they are what you are able to access once you have been determined eligible for Medicaid. Again, the Medicaid card is what allows access to those services. And if there are any questions, here's some numbers that you were probably already aware of for our health program representatives at DHHS who can help individuals. And if you are working with a family to advocate for them, they can assist in kind of going over their coverage as well. The waiver program, again, acts almost as an add-on. So once we are looking at the state plan services, a lot of the waiver services are not are not something that is offered through Medicaid normally. Sometimes we also have services that build on what an individual is able to access through the state plan. An example of that is a supportive maintenance service, for example, where the individual may have a limit on the number of visits they can have. Through the waiver, we are then able to supplement them and provide them more if that state plan allotment is not enough to meet their need. But generally, we're offering services that Medicaid normally does not pay for. A good example as well was when autism services started about 10 years ago, 12 years ago. That's actually what brought me over to then the Department of Health. It was our first program that Medicaid paid for and in compensating for ABA therapy. Now ABA therapy has moved to the state plan, and we are covering all ages through adulthood now as well. But again, it allows the state to negotiate with CMS services necessary for each of the individual populations for the waiver program, and try to supply those again to prevent the need for facility-based care. Right, and then just acknowledging that we're looking through a lens of a comprehensive care plan that combines all of the services that somebody's receiving in order to meet their care needs. Through the 9 waiver programs, we do have 3 different divisions throughout Medicaid or throughout DHHS that assists in the day-to-day operations. My office, again, Office of Long-Term Services and Supports, we are the state Medicaid agency. We provide oversight for all 9 waiver programs, but we do partner with other agencies who have greater expertise. Our partners at the Division of Services for People with Disabilities administer 5 of the waiver programs. Well, there's some brief introductory information on how an individual can apply that we think may be helpful when you guys are working with families. 3 main ways you can contact them to have a form mailed out. There is a downloadable packet as well that's available through the website, and DSPD is recently now also taking applications through their website. All of those links are provided on the page. I will refrain from reading off the slides, but great resources there if you have a family that frankly does not know where to begin, which is often the case for many of the individuals we serve. Medicaid doesn't necessarily have an advertising budget, so we do rely on expertise within the community to assist in getting word of mouth out about just the existence of our programs at times. So again, resources when you are working with a family. Just a little bit, and I think many that have worked with programs with us do understand that waiting lists do exist for several of our waiver programs. I think this is the one that usually draws maybe the most attention as we start to hit on the legislative session. While we are serving roughly 6,500 to 7,000 people with intellectual disabilities and related conditions, we also do have a waiting list of about 3,500 to 4,000 at this time. So it is rather extensive for DSPD's programs, something that we obviously take very seriously, but something also to be aware of when you are working with a family is that even though they are applying, that there could be an extensive wait for support. And also something that we have done, and I think it is well-intentioned, but services are not necessarily first come, first serve. Longevity on the waiting list is a factor that is looked at. However, the critical need of the individual and family is something that does offer a greater consideration when we are looking at filling an available slot on the waiver program. Again, it is best for families once they have applied or when they are working with a caseworker to have that discussion with them to learn more about the wait list, where they may be sitting in relation to others and how that assessment process works. But again, just to know that it is not first come, first serve, and that there is a major factor based on the circumstances of the emergent need for the family that is reviewed. Other eligibility factors, and we do love our acronyms within Medicaid. The Limited Supports Waiver, Community Supports Waiver, Community Transitions Waiver. When we are looking at intellectual disability and related conditions, there also has to be assessed functional limitations resulting from those diagnosed conditions. And we go through a process to establish that level of care. Each waiver has its own level of care requirements. So we do assess physical health differently than we do for an acquired brain injury, than we do for intellectual disability. So just be aware that there may be kind of varying requirements as an individual is applying for different waiver programs. The nice thing is when an individual does apply with DSPD, all they need to do is kind of work on sharing the information regarding the individual applying for services, and DSPD will look at which waiver program makes the most sense for them to participate in based on those qualifying factors. So it's not necessarily, I want to apply for the community supports waiver. It's an acknowledgement that I have a disability and I need support. Please tell me what I might qualify for. And just to be aware of the factors that DSPD is looking at with those applications. The limited supports waiver is our newest waiver program. It started a couple of years ago, and it was in response to the wait list that does exist for the community supports waiver. An acknowledgement and maybe a plea from some of our families where if a little bit of support can be provided, it would be incredibly helpful for that family unit to kind of remain intact, avoid some of the stressors associated with the cost of care, be able to provide some respite for that family so that they are better equipped to continue providing care. We only have, I believe it's around 120, 140 individuals on this program. Still relatively new, and it maybe does suffer a little bit from that competition between funding for our programs, where it's hard to ignore, again, a 4,000 person wait list, and trying to be able to work with lawmakers to understand if we can provide support a little bit earlier on in that family's trajectory, it can probably prevent or delay the need for more costly support later. But again, hard to set that aside from the families who are in crisis today as well. So just the unfortunate circumstance of very worthy programs, and it's very hard to target funding at all points. This is also a very interesting waiver program, where it's our first one that does have a cap services amount. So the family is essentially with their support coordinator, works to figure out the supports within the waiver program that makes the most sense for them. So they are offered a little bit of, again, maybe more of I don't want to frame this as a blank check, but they do have an array of supports that they can look to purchase with the funding that is available to them, and they get to determine perhaps it is most cost effective or meaningful for them to do a home modification or a vehicle modification, and that would eat up the majority of their budget in a given year, or they could look at supports within a rehabilitation program. So it really places a lot of the direction and control of the program within the family's purview, and lets them figure out what makes the most sense for them. The community supports waiver is, and this number is a little bit out of date. At point in time, we are serving about 5,800 to 6,000 individuals on the waiver program. This is one of our longer standing waiver programs, has been around since the early 90s. And again, primarily serves individuals with intellectual disabilities, other related conditions. Both the limited supports waiver I just spoke about, as well as the community supports waiver, serve individuals of all ages. So birth through elderly years can be covered by the programs. The community supports waiver, and one of the big cost drivers is we do pay for residential care in the program. We cannot compensate for room and board directly, but when you hear about like group homes and portions like that, these can be small 2 to 4 bedroom homes with individuals, again, with intellectual disabilities related conditions. That ends up being one of the largest cost drivers for the program, one of the more costly services there. And there is no age limit on either limited supports, community supports waiver. There's actually only one of our waiver programs that does have an ineligibility age, we'll call it that way, where they do age out of supports, and I'll make sure to call that out when we get there. The community transitions waiver is also fairly new. This was a program that resulted from our legal settlement with the Disability Law Center and provides an opportunity for individuals who are residing in an intermediate care facility to access similar services in the community, allowing them to live in the least restrictive environment, again, that can meet their needs. The difference between the community transitions waiver and community supports waiver is really that entrance mechanism. So an individual has to reside in an intermediate care facility for at least 12 months before they can come onto this waiver program. And also, from a service perspective, they also have access to nursing supports. Obviously, within the facility, there may be a significant medical need, chronic health condition that was being managed. In order to safely reside in the community, those nursing supports may be required here as well. The acquired brain injury waiver, this is one of the first one that strays from an age range, both the acquired brain injury waiver and the physical disabilities waiver that I'll touch on next, do require an individual to be 18 years of age or older. The ABI waiver, as kind of the name suggests, is we are looking at individuals who have suffered from a condition that has affected brain activity. A bunch of different diagnoses can be considered. You can see a few of them that are outlined in the text. As far as it could be a TBI from an injury specifically, a car accident, sport accident. It could be hypoxia or anoxia, issues with oxygen to the brain. And typically not ones that occur at birth, but ones that may have happened afterwards. Again, just best if you are aware of an individual, refer them to DSPD, and we can assist with the different types of diagnoses that may qualify. From a services perspective, this program does match largely the community supports waiver. Obviously, just a little bit of a different population, and we frequently have individuals participate on this program living with individuals who may be served on the community supports waiver. All individuals have a choice in their roommate, a choice in their living arrangement, but we do find commonly that we see overlap within these programs. Again, a little bit more of the into the weeds on the eligibility criteria, level of care requirements for the program. Again, just reiterating the suggestion to work with DSPD to confirm, but know that we are looking for clinical information that does support the diagnoses. We do look beyond perhaps just a doctor's letter. It often does require pretty extensive information confirming that disability occurred either before the age of 18 or 21. So there's a fair amount that does go into the review. Just a quick list of many of the services that are available through the three programs. Oh, pardon me, limited supports was previous. But just an example of what can be provided to individuals and families to help support them in the community here. The physical disabilities waiver is a lot more limited from a service perspective. This program does serve individuals who have lost the functional use of 2 or more limbs. That could be amputation, or it could be loss, again, of the functional use in relation to a stroke or other life event. And can be provided individual, or again, services to individuals 18 and up as well. This program also does require the individual to be able to self-direct their care. And what we mean by that is we do not enlist the assistance of agencies or providers as you might traditionally think of them. The individual ends up being the employer of record for the personal attendants that they work with. It is a program that does run on a little bit of an element of self-sufficiency and the ability to coordinate their care. We do have another program that does offer different support for individuals where the physical disabilities waiver may not make sense for them, but it does require the individual to be pretty autonomous. And this waiver program is serving only about 100 individuals roughly at this time. Again, very limited array of supports within the waiver program. We do have services like med dispensing devices, the emergency response system services, kind of the traditional I fall in and I can't get up. And then also the primary support is for attendant care support. So when an individual does have somebody coming into the home to assist with those activities of daily living, that's the primary focus, but we do have a couple of other ancillary services. Aging and Adult Services partners with us on the Aging Waiver Program. Understanding the focus of this group, I'll kind of breeze by this one a little bit, but just understand that it's primarily available for seniors, individuals who are residing in their own home of a family member, and meet that nursing facility level of care requirement. Again, a handful of support to help make that independent living a little bit more accessible as an individual is getting on in years. This program also does offer attendant care, companion services for those that may need social support as well, so that they can have somebody assist them at home or in the community, perhaps not necessarily with those activities of daily living, but more so just that social connection. Assistance with non-medical transportation, as that can be very vital to seniors to be able to access the greater community. And things like supplemental meals. We offer both kind of the home delivered meals for those that may be looking at Ensure, Glucerna. We can assist with some of the costs there, or even paying for a gift card so that they can go out to a restaurant with a family member or friend. Again, both driving maybe the nutritional need as well as that social need as well for our aging populations as well. And then the last three programs are operated internally at the Division of Integrated Healthcare within the Office of Long-Term Services and Supports that I oversee. The New Choices Waiver Program both kind of encompasses the populations with the physical disabilities waiver as well as the aging waiver. When an individual may not necessarily be able to reside at home safely any longer, they may be relying on assisted living services, for example, and that's one of the big differences between the aging waiver and New Choices waiver is access to that residential care. Again, Medicaid cannot pay for room and board, but we are able to compensate the facility for the attendance, the staff, the emergency response service portion that may be occurring at the facility. So the individual and family negotiate that room and board, and then we come in and pay for the staffing support that the assisted living may be providing. This program serves individuals who are aged 18 and older, and both the physical disabilities waiver and New Choices waiver an individual can get immediate access to the waiver program when they have been in a nursing facility for a stay of 90 days or more. So this very much is an intention for us to serve individual in the least costly alternative, and then also the least restrictive environment for them from, again, that quality of life perspective. So as soon as they are safe to do so, they are able to transition directly into the waiver program if that is their choice. Again, some of the admitting factors for New Choices. We do have some limitations. They cannot meet an intensive skilled level of care. That their primary condition cannot be mental illness. We don't necessarily play the game of trying to understand between a mental health issue and a physical health issue, which one is the primary driver of a given need. But there is a notion of if the majority of their condition does surround a behavioral health or mental health concern, we cannot serve them on this waiver program. So that can be a limiting factor for them here. And it is not for individuals who would require services in an intermediate care facility. We do have a few nuanced situations there. So Medicaid seems to be the program that operates by exception at times. So again, very good idea to reach out to staff within the program to talk through any complex cases you may run into. And again, at the start of each program, we've tried to leave the primary contact that you can reach out to for any questions as well. I'll skip the length of stay piece, just understand again, the New Choices primary position to help individuals move from a higher level of care, or I guess a more restrictive level of care or facility into a community-based arrangement. And again, those stays only have to be relatively short as far as the ability to access the waiver program. And then just the array of services, again, very similar to aging waiver, with the difference that we do have the adult residential services added on for the New Choices program. And then our last two that are highly targeted to pediatric populations. So I mentioned the medically complex children's waiver program. This program started about 9 years ago under a pilot. We are now up to 900 kids on this waiver program alone. So has been very gratifying to kind of work and see the program grow. A lot of excellent support from legislators as well. So very grateful for their assistance. And for the first time, unfortunately, we have reached the point where we do have a waiting list. Previously, for those that might remember, we used to take applications through open enrollment. We now accept applications anytime, and we do assess them based on critical need. We do have kind of a scoring system that we use for individuals when they apply, giving them criteria for or giving them points based on assessed criteria, like if they are receiving ABA therapy, if they are wheelchair bound, mobility issues present. So when we are pulling children off the wait list, they are the ones that have been deemed most critical, and really trying on a monthly basis as we see attrition on the program, as families leave, they may move out of state, or as children age off. I mentioned earlier in the presentation, this is one of our few programs where you can lose eligibility based on age. Once a children reaches the age of 19, the month following their 19th birthday, we will instead put them into an aged blind disabled program that Marilyn and Wendy touched on. So kind of that acknowledgement, again, where the waiver programs allow us to target the child's income and assets. Once they are 19, they can apply for and qualify based on their own merit. So we usually see kids transition straight off of the waiver and into their own coverage on Medicaid. And that was always kind of the predominant focus of this program, was getting families access to Medicaid, getting them that support through state plan services. You can see the handful of additional support that we do provide, but really the respite care that's provided is a maximum of 13 hours per month. So it is not a very high or very rich service package, but again, that access to Medicaid as a payer for a lot of therapies that you are aware of that are very expensive. Access to ABA is not inexpensive. Things like nutrition, for example, that was a big sticking point for us. Most primary insurances do not pay for things like that. So again, access to Medicaid was the primary focus here. And sorry, a little bit out of date with the numbers here. But complexity, and we're always kind of tinkering with the eligibility criteria, trying to make sure that our catchment is focusing on the children and families intended to be served by the program. So always working with lawmakers to refine that better. But again, the disability or the child's medical complexity needs to involve 3 or more organ systems, need to be working, and we're in the process of changing specialty physicians over to specialty providers. We know how frequently they may be working with maybe a more informal type support, or the fact that a lot of physicians are not the primary ones performing care at this stage, although they may be overseeing the treatment. So again, trying to acknowledge the different way healthcare is evolving. And then lastly, the technology dependent waiver program. Some of you may be aware of it or have heard of it as the Travis C program. Very long-standing waiver, also from the early 90s, serving about 140 kids. And there is a pseudo age range on this program, but it very much was intended for children with, frankly, concerns following birth. It could have been genetic conditions, but as long as they come onto the program before the age of 21, they can remain on the program indefinitely. So it's a little bit of a strange way that we do the entrance to the program, but very much a pediatric focus. Although we do have a few individuals that are into now their 30s because of the way that medical care has evolved, the different support that they have been able to receive. A lot of these life-limiting conditions where they weren't expected to reach even adolescence, where we're now seeing them move into their 20s and 30s, which has been phenomenal, and also has been very curious for us, where again, a primary focus as a pediatric program that is now serving adults, where we're not talking about 10, 15-pound babies, but 200, 250-pound adults, and really needing to kind of address what has been happening in the evolution of that program as well. The primary focus of this program is really getting the family additional support within the home from a skilled nursing perspective, relying heavily on pediatric nursing support that we receive from providers there, and does require at least one member of the household to be trained and able to perform any cares. Should a provider not be available, should there be a missed shift, or just understanding that we're very seldom providing 24-hour care, where the family does need to be able to provide support with things like suctioning, G-tube feeds, monitoring and taking care of central lines. So obviously, as the name suggests, very complex health conditions. Most commonly, children are coming onto our program who require ventilator-based care, so the airway portion. And I see that we're at time, so I think that largely wraps up where we are. I do want to leave a couple minutes for questions if there are any. I'm still available for a moment. And we had some ancillary pieces here with the settings rule and EPAS that I'll go ahead and skip. The settings rule really contemplates that we need to make sure that individuals receive the highest level of dignity, privacy, and respect when they receive services. Frankly, to assist with again that least restrictive environment, making sure that we aren't infringing on human rights without a valid health and safety reason. And then the EPAS program is one that does assist individuals with disabilities who are not on a waiver program to receive some additional attendant care support while they reside at home, and to help support their employment efforts. So I will go ahead and finish there if that's all right.
Great. I'm just going to launch our meeting evaluation, but people are welcome to ask questions for the next few minutes if they're able to stay on the meeting. I know a few people have to hop right away though, so I'll go ahead and launch this evaluation, and then just remind everyone that our next meeting is January 15th, and our topic is going to be housing services that day. So we'll just allow anyone to ask any questions that they want to before we wrap up.
I have a question.
Yes.
This is Rebecca. Can you hear me?
Yep, I can. Go ahead, Rebecca.
Okay. It's actually in regards to Medicaid. You said I had a patient that she's autistic, and she was on Medi-Cal and moved back here with her family. She's in her 30s, and they had applied for Medicaid, and they were denied because they stated the family's income. But I guess my question is, because you did say there's a program if the patient is disabled and lives with family's income can be not included.
Well, and for a 30-year-old, when they are applying, they would be kind of reviewed as their own household. We wouldn't be looking necessarily at the income and assets that belong to others. If Marilyn and Wendy are still on, they can correct anything that I misstate. And certainly, if this individual were to apply for the community supports waiver, again with our partners at the Division of Services for People with Disabilities. Only their income and assets would be used in that determination. And autism is a condition that is considered a related condition. So that could be a route to support anyway. But I believe for a 30-year-old, they would be applying based on their own merit, and would be able to establish disability on their own as well.
Yeah, and I think her mom did the application and included their income. And so is there anybody else that can help them, like to apply for that, or someone that can help them with the application status, anything like that? Because the actual patient is not able to do it herself.
And with a releaser information, that would enable the parents to assist on her behalf. And really, the folks at DWS should be able to supply the necessary support. Again, just evaluating what program she could qualify for. And again, with if there is a claim disability, that would need to potentially be reviewed by Social Security or the State Medical Review Board. But that would be a way to have disability reviewed, and that should offer the opportunity to qualify for um, the one of the spend down programs. So while a lot of our programs do have income limits, that can just establish when an individual needs to kind of pay the difference between federal poverty limit and wherever their income may be. So it can still offer access to emergent coverage that way.
Okay, perfect. I will let her know. And she can also contact DSPD too, right?
Absolutely. With respect to the application and the intake process, it is very common for parents of adult children to help throughout the application process.
Okay, perfect. Thank you so much.
Of course.
Merry Christmas.
Merry Christmas.
Do you have any other questions? I haven't seen any come in through the chat either, so I think we'll go ahead and end there since we are a little bit over. Thank you so much for your time today, and I will be sure and send out all the slides and information that was shared in today's meeting, along with the recording, if people want to review what was said.
Thank you for having us.
Thank you.
We appreciate it. It's complex stuff, so thank you for trying to simplify that for all of us. Thank you so much.